Dr. Kevin Kavanagh is the founder and president of a national organization called Health Watch USA. He himself is a retired physician. Dr. Kavanagh, good morning to you.
Good morning, sir.
How are you today? You keeping healthy?
I am. Yeah, I'm fairly awake for early Monday morning.
Good. Well, it's actually Wednesday, but that's okay.
Oh, Wednesday. Well, that's all. Jack, it all blends together.
That's funny. Southern governors are opening up states when rates are not declining, which defies the White House guidance. Your thoughts on that this morning, sir?
I think it's a huge mistake. We've talked about that before, that this peak is really artificial. We can easily start to head back up again if we let up with social distancing and with stay-at-home orders. The whole idea is to drive the rates down so low that you can then handle the outbreak with case tracking. And if you open up early, this is just going to come back and come back harder. And I think we really need to start to get firm messaging from the White House that you need to follow this guidance. That is of utmost importance. And this is not a political issue. There are many Republican governors and many Democrat governors which are following White House guidance, and I think everybody needs to get on board with that.
Yep, you're right about that. What about this? You've got this quotation from the CDC's director, Robert R. Redfield, Dr. Redfield. What did he say?
Well, Dr. Redfield said that we need to prepare for a second wave, possibly in the fall, and that wave, similar to the 1918 flu, could be even bigger than the one that we're seeing now. And we've talked about that before, Jack. And I think that they're coming out with this at this time because they're really upset with the Southern governors, saying, look, this can be one of the repercussions of what you're doing. And unfortunately, once you do these type of moves, you can't back away from it. By the time you see an uptick in cases in your state from what you've done, it's too late, because by the time the disease appears, it's already been spreading for 1 to 2 weeks before that, and it's hard to reverse. So this is a very, very bad decision on the part of these governors.
We were sharing with our audience a story this morning earlier about a new study that shows that hydroxychloroquine medication actually has no effect and maybe even has negative effect on the coronavirus?
That's correct. The study was retrospective, so the results weren't randomized. It could be that the sicker patients got the drug.
Yeah.
But nevertheless, when they looked back and saw how patients did, there was over twice the death rate in some of the hydroxychloroquine groups. They had one group that just had the drug, another group that had the drug plus an antibiotic, and then a group that didn't have anything. And twice the death rate is very disturbing. I have not seen any study to date that has shown this to be effective, except for the initial study, which has a huge warning on it now by the journal Society that published the article. So people need to be very wary of this. And this was a huge error. Not only did it expose a number of patients to a drug now which may have harmed them, but the drug absolutely disappeared off the market, so that many patients who needed the drug, such as those who had rheumatoid arthritis and lupus, weren't able to find it and to take it. So again, a lot of harm was created by this hydroxychloroquine kind of scare. I mean, it just is not a good thing.
Well, my understanding was, and you can correct me if I'm wrong, Dr. Kavanagh, but I think I heard or read that those initial reports about the medicine being a possible treatment had come out of China. And I just wondered, if that's true, why would we pay attention to something like that coming out of China after we're so convinced that their numbers are so, askew?
Yeah.
Yes.
Well, that's been one of the problems I've had, that a lot of our policies have been based on small reports that are coming out of labs that oftentimes are in China that have not been verified. And there was an article several years ago about well over 50%, I think it was close to 70% of the Chinese research were being sanctioned by the Chinese government for having integrity problems. Research can have integrity problems. That's why it needs to be verified. Even in the United States, But when it comes out of foreign countries, I think we need to be very suspicious of that. And it's not just a problem with the hydroxychloroquine controversy, it's also a problem with other types of treatments and recommendations that we're making during this epidemic, is that we do not have the information. Remember, this virus has only been around for 2 months. This is usually a process which takes years in order to have an article out and to have peer-reviewed research and this debated in the literature. So everything is being fast-tracked, and because of that, there's a lot of misinformation and a lot of information which needs to be verified, which just can't because of the time period that you have to look at it.
Well, when you consider that we also live in a time of social media, I had a story last hour that said camel urine may be the cure for coronavirus. Well, if you put that up on your Twitter account today, by 10 o'clock this morning, it may be, worldwide. I mean, you just don't know. So that's the problem. The people are grasping at about anything, and unfortunately, the scientists are too. And so sometimes, even in the scientific literature, you'll see things that come out that are not true. And there's also, unfortunately, there's a lot of money involved. I mean, if someone finds the cure for this coronavirus, they expect to be rewarded handsomely. Sure. And so that there's a lot of pharmaceutical bias. There's a lot of bias in researchers, and you've got to be very, very careful on what is being recommended. And right now, the best information that I've seen is coming out of the NIH and Dr. Fauci. He has had I think, a history of being on target with many of these issues. Pay attention to the scientists. Pay attention now to the CDC. They're starting to come out with good information. And they're starting to not to sugarcoat what's happening, because people are starting to do actions which aren't following guidance, which may have severe repercussions in the future. Dr. Kevin Kavanagh, as always, thank you, sir.
Okay, thank you, sir.